Good day, everyone. I welcome you to this session. This is Coach Evelyn Fusudo, a mental health coach and a caregiver. Today, we want to take a look at responsibilities of a caregiver. Who is a caregiver? A caregiver can be anybody, can be a wife, husband, sister, brother, uncle, auntie, children, caring for someone that we love, our loved ones, our friends, our neighbors, and our well wishers. So, as a caregiver, what are the responsibilities of we that we say we call ourselves a caregiver? As a caregiver, there are a lot of things that we need to put in place, and there are a lot of things we should know about our job when we care for people, especially people that need the help. A caregiver is someone that is compassionate, a good listener, a companion, a understanding person, an interactive person, a person that care and do not want something in return, a person that finds joy, love, and happiness in doing his or her job. That is a caregiver. So now I want us to take a look at the responsibilities of a caregiver. In these slides we're about to see, we'll be seeing different um, roles or responsibilities of a caregiver. And I want you to follow me as we begin. One, personal care assistant. Just like a PA, caregivers are often responsible for helping with basic activities of daily living. And what are these daily living? A lot. Bathing, ensuring that the person is clean and the person have a very good personal hygiene. The person you are caring for, if it to be an elderly person, you will not allow the person to be, smelling. You want to make sure the person looks good and the person is smelling nice. So bathing is part of the work of a caregiver. By bathing for the person, especially those that need it, maybe the aged ones that cannot lift their hands or move from one place to the other. You'll be able to bathe for the person on the wheelchair. You'll be able to take the person to the bedroom to bathe for the person, to care for the person's um, bathing. Then dressing as well. You are to choose a very nice clothes depending on the weather. The weather will determine the person's clothing. The person's state of health would also determine the clothing the person will have. So, for example, somebody that is prone to cold or somebody that is allergic to a cold environment, you cannot expect to wear something that is exposed, that will expose the person's rib or chest. So, you need to take note of the person's health status before choosing clothing. Also, you must make sure that the person is looking nice in the clothing he or she wears. Then grooming, the person must, brushing the person's hair, shaving, maintaining nails, not keeping nails. That will be, proper grooming that will enhance the person's dignity, the person worth, and the person's pedigree. The person will feel among the years, even with my disability, even with my state of the state of my well-being, I've been able to look good, looking nice, and people appreciating me the way I look. So these are part of the personal care that you need to give to the person you are assisting. Then toileting. Some people might find it very hard to go to the toilet, that's to the ladies or to the gents. So as a caregiver, you help the person to wipe after using the toilet. And if were to be somebody that is using a diaper, for example, people that they can't say anything, that okay, I want to urinate, or I want to defecate. They're having issue. Maybe the person is down with a stroke, and the stroke affected the person's speech. The person will not be able to communicate that this is what I want to do, and the person also, maybe he or she is not able to move from one place to the other. The person might mess himself up or herself up. But with the help of a caregiver, the person will be able to care for the person. You change the person's diaper. And if we're to be somebody that is having issue with maybe urine tract, for example, and the person is wearing a cataract, you know when to change it, the morning cataract, the morning bag, you know when to empty it, you know how to empty it, you know how to care for all those things. So toileting is very, very important, so that the person will also have a privacy and a comfort zone. So, for example, a caregiver may need to help an elderly person who struggles with balance and mobility take a shower safely, possibly using assistive devices like shower chairs or grab bars. So, it is the work of the caregiver to make sure that all these are in place. Another one is medication management. This is very, very important, and this is live medication. Many individuals, especially the elderly, require multiple medications. A caregiver role in medication management includes the way you administer the medication, very, very important. How you track the prescription. You must also monitor the side effects of this medication. For example, when you administer the medication, you should be able to ensure that this person take the correct dosage. When the person do not follow the doctor's prescription, and as a caregiver you do not monitor that, you have failed in your work. So as a caregiver, you must make sure that the medication administered are well used and the dosage are correct, and you must make sure that the person take it timely, the exact time that he or she needs to take it. For example, some people, maybe the prescription is take this every 8 hours or every 2 hours. You must set that time. You must set that alarm for that person to know, okay, yes, this is the time for you to take your drug. This is the time for you to take this, even if it is water, something like that. So you have to do that job by managing this. Then also tracking the prescriptions. You must make sure that you track the prescription. Okay, for example, maybe it's a refill one, you put it, yeah, you get to take a look at, this drug is getting low, is about to finish. It's your job as a caregiver to get money and get another can of medication for that person. So you must track it. If there is also side effects. For example, you have to notice, is there rashes? Maybe you notice rashes on the person's face, on the person's body, and or the person is complaining that I'm feeling like this, I'm feeling like that. All these side effects should be reported to the doctor, so that they can also see maybe there is a particular thing that the person is reacting to, and also they will also check, okay, maybe this is doesn't suit the person's system, let's try this. So as a caregiver, you have to monitor and manage your person that you are caring for. The person you are caring for, you must make sure that you manage the person's medication and make sure that the person is using the right dose at the right time. So this is a work of a caregiver, the responsibility of a caregiver as well. Then mobility support. Mobility support is very, very paramount as well because you help the person to move from one place to the other, like transferring the person from the bed to the chair, or from the chair you help the person in the bedroom hold this particular bar so that the person will stand straight. You'll be able to take care of the person's needs as well. So when it is time for the person to sleep, taking the person or carrying the person from the chair to the bed and using of bathroom and all that. These are mobility support, which is transferred. Then walking assistance, sometimes you can engage in walking the person by helping the person, by assisting the person, maybe holding the person on the waist, or you hold the person side by side. So all these you need to be there. That's physical support for the person. You don't need to wait for the person to tell you, because you are always there to tell you that I want to do this. So you know the person's move, so you know what to do. And how also you can also have some assistance like walkers, canes, and all that, that can help the person for mobility. Then you are also to make sure, because as you are doing this, you are as well preventing the person to injure himself or herself. So fall prevention is very, very important. Ensuring the environment is safe. Take away all those things that can make the person to fall. Take away all those things that can make the person to endanger the person's life. So all these things you have to take them out of the way, so that when the person is working or when the person is moving from one place to the other, this will not be an hindrance or be uh, detrimental to the person's well-being. So you also do this in order to avoid fall of your client or the person you are caring for. So, for example, a caregiver may help an individual with arthritis getting up from the chair and walk to the kitchen, offering assistance if needed to reduce risk of fall. Very important. Also, meal preparation is also important. You know what you put, there is a saying that you are what you eat. So, you have to track your client or the person you are caring for. You have to track the meal, the meal preparation, how it's being prepared is very, very important. Fine, you might be a caregiver and you are not the cook, but you must monitor what the cook is preparing for your clients. And as a mother or father that is caring for your aged one, you know that mother doesn't need this, father doesn't need this, you know what to do. So what you need to do is you monitor, for example, somebody that is diabetic, you know that you must not include anything that will spike the person's sugar level. So all this you need to put into consideration. Meal preparation is very important. Cooking healthy meals and making sure that the person is eating the right diet. The right diet should be given. Then also the feeding patterns also differs depending on the person's health. So some people, maybe they can't feed themselves. As a caregiver, you are the one to feed. You can feed, maybe the person is feeding through tube, or the person is feeding by hand, by helping the person, because the person might not have the ability to lift his or her hand to eat. But you can feed the person by feeding the person by hand. And if it's through tube, the person can also be fed that way. So you must study the feeding pattern of your client or the person you are caring for. Very, very important. And make sure that the person stay hydrated, because it will not be nice for somebody to be dehydrated. Even as a caregiver, you must take a lot of water because you need energy to do your job. So the person you are caring for too needs water. So you monitor the way the person drinks water. Make sure that is drinking enough fluids throughout the day. So these are very, very important. So in our next presentation, let's take one more again. So mobility support, I think I've talked about that before. So then another one is Household chores. By maintaining clean and safe environment is essential for the well-being of the person that is receiving care. Yes, everywhere must be sparkling clean, because any iota of dirt can also cause an infection to the person you are caring for. So the regular cleaning area of the home, such as kitchen, bedroom, and common areas. So we get a lot of diseases from even the bedroom sometimes, so some bacterias, but you have to make sure that they are cleaned regularly. Then laundry, washing of the person's clothes and ironing them, folding them neatly, very important. And tidying up, helping to keep the living space free of clutter, which could pose as a risk for accidents. So as a caregiver, these are some of the responsibilities we need to take note of. So as a caregiver, I don't want you to give up. You have to be compassionate about what you do. You have to be understanding. You have to be a good listener, and you must not complain too much. Your client or your patient or the person you are caring for should be able to vouch for you, or should be able to have that mind that I am safe with this person. Then you can engage in different games with the person to bring out what companionship. Companionship is also one of the responsibility of a caregiver, which is very, very important. You have to be compassionate, like I said, and then you have to, be interactive enough. Let the person go out, take the person out for a movie. Maybe the person love to watch movie or to see movie, go to gallery, go to cinemas to see movie. The person's lead character that he or she love the most. Then if the person is a reading type that love reading novels, get novels that the person love, read to the person will enjoy it. If maybe the person love listening to music and the artist that the person love, you can also play the music or dancing. And if the person is a newspaper type, get to newspaper, get publications and read to the person, so that to get the person updated, and also to also help the person to do things very well. Then all this will make the person to have sense of belonging, that yes, even with my disability, even with my state of health, I am still important in the society. You are a ray of hope. That is why you're a caregiver. So as a ray of hope, you must be an epitome of hope everywhere you are and everywhere you go to. As a caregiver, you are hope, and you must give hope to those that are hopeless. So let them be optimistic and not pessimistic. See you in our next class. Ciao. This is your mental health and caregiver coach, Evelyn Fosudu. Thank you for listening.